Neonatal opioid withdrawal. It's really unpredictable. We don't really know why. We have found that it's not dose dependent. So somebody that's on 30 milligrams of methadone might have a baby that has more symptoms than somebody that's on 60 milligrams of methadone, and we don't know why. Not everybody that is on some sort of opioid medication has a baby with symptoms that require treatment, and we don't know why. I suspect that it has to do with the quality of prenatal care, the evenness of the dose throughout pregnancy, and other health factors. For example, for all babies, not just babies with substance exposure, girls do better than boys for just about every health condition. We're just physiologically stronger than you guys. But so there's factors like that that can affect the outcome and the signs. So newborn opioid withdrawal is signs, not symptoms. You'll notice I talk a lot about language. Symptoms are something that is reported to the nurse or other healthcare provider by the patient. So babies can't have that. So with babies, we just have to look at them and how they're acting, and that will tell us what they're feeling. So the signs of newborn opioid withdrawal, there's a lot of them, and I'll talk about that in a second, but the main ones are irritability. So that means normal baby stuff is just going to be kind of turned up a couple notches. So like you unwrap a baby to change its diaper, it's going to cry, any baby. If you unwrap a baby with opioid exposure who's showing signs, they're going to cry longer, they're going to take a little longer to calm down. Poor feeding. Part of this is stomach upset and part of this is organization. If anybody has ever kicked in this room, you know that stomach upset is a big part of that. And the other part for babies is that when you're born, you have to learn how to suck and swallow and breathe all in a coordinated rhythm so that you don't choke on your food, and that's a brand new skill. So it's a difficult thing to learn for all babies, but particularly if you're feeling uncomfortable and you have to breathe faster than normal, so that can be an issue for babies. They also tend to have a little bit more regurgitation. So again, all babies spit up, these babies are going to spit up a little bit more. Respiratory distress. This is part of just whenever anybody's in pain, our heart rate goes up, our oxygen consumption goes up, our calorie consumption goes up. And with that, we have increased heart rate and increased breathing rate. And if you need more oxygen, you're going to be breathing faster. And if you're not able to get enough oxygen, then we might have to give babies extra oxygen through like a nasal tube or perhaps a CPAP machine or something like that. And that's more rare to need to do that, but we do pretty generally see higher breathing rates.